hear this conversation in Portuguese or Spanish. Without further ado, I would like to turn the floor to Andy and ask him to let us know or more inform us more broadly about the activities that the WHO had made over the last couple of years and beyond to address this infodemic in the global scale. Andy?
Thank you very much, Baybars, and a pleasure to be here with such a great panel. From WHO's point of view, we've tried to get more health messages to more people through more channels so that they can make healthier decisions. And during the pandemic, obviously, our goal is to save as many lives as possible and to bring the pandemic to an end as quickly as possible. We hope that by getting messages into people's lives, people will make better health decisions. So at WHO, we've got sort of three basic pillars of our work. The first is that we raise good content. The second is that we fight misinformation. And the third is that we gain user insights about what's going on so that we can create better content. You know, let's create content that people are actually looking for. And I'll give you a few examples of what we've done and how the industries, the tech industry, has helped us fight misinformation and raise good content. So one of the biggest examples of our work has been on Google Search. We've worked with Google Search team to bring as much content as possible with regards to COVID and COVID vaccines and COVID information into people's lives. If you go to Google today and you do a search for COVID, coronavirus, or 30 similar terms, what you'll see is not your normal SEO search engine optimization results. What you will see is an organized search results panel, a specially made panel which highlights the different areas of the pandemic. So you have symptoms, you have any therapeutics, you have information about the vaccines, you have latest news, and all of that is sorry, there's a big echo in my ear at the moment. Could somebody mute? Sorry about that. So what we try and do with Google Search is to raise good content. So we raise WHO content, but we also raise Ministry of Health content. And what that means is that we worked with them to highlight which were the health authority in each country to identify the Ministry of Health. And where that Ministry of Health had information, we would raise it. Where they did not have information on that specific topic that was being searched, they would use WHO content. So that's a perfect example of how we've raised content. We have many more. We've worked with, for example, Facebook to get our health information into the COVID Information Center. That COVID Information Center has been pushed into everybody on Facebook's lives and in their feeds. And what we do, we work with them to elevate content at the right moment into areas of the world where it's most needed. So when a country is going through a wave, we talk to Facebook about raising content into those people's lives. The second pillar of work, as I mentioned, is fighting misinformation. And that means going to individual posts, going to individual people on individual channels or even platforms to fight misinformation, one at a time or many at once in a certain topics. But the real work we've done with fighting misinformation is working with the fact checking, the policy teams, the safety teams in each of the large social media companies to get them to improve their policies on health content. So we've worked with Facebook, YouTube, TikTok, Kaishu, and all the subsidiaries, like Instagram and things like that. A good example of our work in this space is every week we get on a call with YouTube policy teams, the health policy people, and we sit down with them and talk about all the questions that they've got with regards to content that they're seeing on the platform, which they think might be misinformation or might be anecdotal information, and we give them advice on how best to position their policy. Of course, it's then up to them to take the responsibility to improve their policy and then implement that policy and police it. But we found this kind of work extremely rewarding, even if it's quite complicated, quite laborious, certainly very unsexy work. Is behind the scenes, a lot of hard work to get things done. But when it comes into fruition, when it actually works, what happens is algorithms and their engineers can remove thousands of hours of content that's promoting misinformation. I'll finish off with something which is very dear to my heart, and that's everything that we're doing for COVID. We want to keep us to roll over to other health topics. So, for example, we want the COVID pandemic to be a catalyst for change in the tech industry, in social media industry, and in the gaming industry, especially to change the way they think about health information moving forward. We don't want this to be a one-off campaign. They have to change, they have to grow, they have to learn, and they have to become better at making sure that we keep the misinformation off the platform and continue to raise good quality content. And in that respect, just yesterday, as an example, we launched a breast cancer chatbot on Viber just to show that we want to work with these companies on more than just COVID. So we're now raising breast cancer awareness and women's health in a specially dedicated chatbot just for this, to fight misinformation on the platforms. So that's it from me for my introduction. Back to you, Baybars.
Thank you so much, Andy. And I really appreciate you bringing up the efforts that you do with tech companies. I mean, you touched on a very important point, which was about letting them know what the best practices are, but then it will be eventually their, own responsibility to fulfill those expectations. And here today we have fact checkers from three different countries. Each of them are among the most hard hit countries during the first couple of months of the pandemic, and even beyond that. So I would like to turn the floor to the conversation on how fact checkers have coped with this situation, especially during the peak of the pandemic. And I think there's no better person at this room other than Natália to address this question, given her amazing job in Agência Lupa in Brazil to counter misinformation on COVID-19. And I think we will have a lot to take from her experience as well. Natália, can you help us to understand how it was challenging for you during this pandemic to do fact-checking?
Hi, everyone. Thank you, Baybars, for your presentation. So it's a pleasure to be here with my fellow fact-checkers, and I think they were fundamental in these times that we are going through. And I want to start saying that at Lupa, we consider the partnerships between fact-checkers and public health institutions fundamental during the pandemic. Now we are running a collaboration with the Brazilian Society of Infectology, which is improving our capacity to share verified information with a larger audience, and it's helping people to make decisions about vaccination and measures to avoid coronavirus infection. Last year, during the Global Fact 7, I told you about some products that we launched, such as our daily newsletter focused on public health institutions, and the second season of our podcast named Verifica. And this helped us to build a closer relationship with public health institutions and with health professionals. And this gave us the opportunity to share with them some questions from our audience and have answers to our audience regarding topics about COVID-19. Since then, we launched another product. I want to mention just one or two of them. The first one is a web series of 4 episodes that mix humor and fact-checking. This was part of the campaign Pulse from United Nations, and we were focused on bringing awareness about the importance of not sharing information without fact-checking it. And in this series, we had the participation of creators and digital influencers and consultancy from health professionals. This series had almost 150,000 views on Instagram and YouTube. There's a huge impact in our audience. And in last May, we start a program to train community health agents in Brazil. They are part of our public health system, And in some parts of the country, they are the main reference regarding health for a large number of people. So we did live sessions on misinformation, and we distributed a 10-episode video series using WhatsApp groups where they could receive this content and discuss this content, bring questions and, discuss this with us. And we train more than 400 agents in Brazil in topics such as how you can talk with someone who falls for unverified information, how to identify misinformation on social media, how to search for web content you can trust, and other stuff like this. At Lupa, we're still working in new collaborations, and this dynamic made us start a new approach, if I can say this, that changed our methodology a little bit. We didn't have any official partnerships with public health institutions in Brazil before the pandemic. And as you all know, COVID-19 was a topic which we didn't have any certainty about it in the beginning. And our work is based on databases, researches, all sorts of information that you can prove, right? You know this better than me. So we face this challenge, this problem. How could we prove something to our audience if the researchers and doctors weren't certain about it yet? And then we needed to choose some institutions who were really reliable and who could help us to treat these topics regarding COVID-19 with transparency and objectivity. So this was really new for us, because instead of saying this is false or true because we have this data that proves it, we started to say this is true or false according to this health professional or this health institution, as far as we know. And here are documents and data that we have until now and helps us to prove it. So what I am trying to say here is that we needed to improve our transparency, and we needed to count on more people to lead us in the right direction. And these people were health professionals and public health institutions. So this brings us new challenges, because sometimes we need to change our approach in some topics. And this made us to have an open communication, a better communication with our audience. I truly believe that we learn a lot about it as a team, and it puts Lupa in another position regarding the way we deal with the information. And our audience is more tolerant with us, and they are helping us more now. And summarizing and answering your question, Baybars, we had a good experience with this type of collaboration during the pandemic. We have a lot of good results, but in Brazil, we are dealing with this another challenge. We still have a huge challenge in Brazil, which is dealing with a government who has a totally different approach regarding misinformation. So last year we had a blackout of data because the government was avoiding to giving numbers of cases and deaths to journalists. And until now, they are more concerned in defending the lives saved, for example, than bringing light to this unbelievable number of more than 600,000 deaths that we have in Brazil. So all the verified information that we could share with our audience was based more in the collaboration with independent health institutions and public, but not federal health institutions. So it's not easy, it's hard, but I am sure we have been doing great until now. So thank you, Baybars.
Thank you, Natália. I mean, we all, fact checkers, we do a lot of trainings all around the world. I mean, I know for a fact that you also have done a lot of trainings in Brazil and other places. And, many times this question comes up: what do you do if you don't if you cannot access to data? And what you just talked about is an important testament of the importance of reliable data, reliable information. And when you cannot get that, domestically, you obviously turn into international organizations, and therefore the collaboration between fact checkers and organizations like WHO and others in regional settings are very important. I really appreciate you walking us through that process, and I just can't thank you enough for what you have done over the last couple of years. And so I'd like to start by a memory that I have back in 2019 in Singapore. We were in the Trusted Media Summit in Singapore, and I was watching Syed on the stage with his colleagues in DataLEADS, talking about the importance of tackling health-related misinformation. And it was obviously pre-pandemic. We still did not have, the COVID-19 pandemic at that time, and that was very interesting to hear from a health communications perspective, the importance of doing more research and outreach on the importance of health-related misinformation. So today we have Syed Nazakat from DataLEADS, who is running an organization that has a lot of emphasis on health collaboration between journalists and health professionals. So he will be probably inspiring many of us during his introduction on what they have done at DataLEADS. And I'm pretty sure both Natália and Andy and Syed and then Clara will face a lot of questions from our audience as well. So please feel free to drop your questions to the chat or the Q&A. But meanwhile, I want to turn the floor to Syed and ask him to walk us through his own experience.
No, thank you so much, Baybars, and a really honor and pleasure to be here. I think this is really kind of a historical moment for all of us, actually. We went through something which was terribly devastating. There's something which we have never seen in the last 100 years, actually. And I think there's a great learning. I echo Andy's point about using this moment as a catalyst so that we are much better prepared to deal with the challenge of misinformation in the future. My understanding of misinformation is that for thousands of years, human beings were trying to gather information. We are trying to search for information. But today we are at a stage where there's too much information available. And our job as fact checkers, as journalists and professionals of communication is to make sense of this information instead of gathering more information at times, actually. So I think that's a fundamental challenge, and it requires innovation in thinking. It requires innovation in doing the messaging to the right audience at the right level and at the scale. I quite, the topic of this session essentially is about doing something at a scale, because what's happening right now, the whole world is connected. If there's a video viral in Florida, it can within a minute reach to India and misinform people and can harm people. And we have seen what happened in Iran. More than 700 people died because they believed in rumors that the alcohol can actually cure them. In India, we saw people committing suicide because they thought there's no treatment to COVID. And as you rightly said, actually, we have been working essentially with focus on health-related misinformation for a while now. I think our first workshop with doctors was in 2015. And I still remember a lot of doctors and healthcare professionals were not really, maybe perhaps not able to understand why are we sitting with journalists and fact checkers and what is common between us, actually. So, but I think the future of fact checking and future of dealing with a challenge like pandemic is really deep collaboration. There's a collaboration with people who have a domain expertise, who have an understanding of science, of health, and other issues as well. And then the journalists and fact checkers can actually be there to use tools, techniques of communication and content verification to flag that content, to address that content. But we still hardcore, deep dive, science better. Because what happened during the COVID was also, and we can see it from actually in the last 2 years. When it all started, I remember the first video which got viral related to difficulties, a Chinese doctor called Dr. Li, actually. And then there were a lot of from Wuhan, and then they started moving left, right, and center to the rest of the world. So most of misinformation in that early phase was related about the source of information, source of virus. Then it shifted towards how this virus is spreading to others. Then it became different advisories, including WHOs, which were wrongly believed in some in a final conclusion. If I say a couple of thoughts actually, how we look at the future really in terms of addressing this challenge. I see that we're not going to defeat misinformation ever. It's
All
going
right,
to
I guess we are.
be a human. It's going. Yeah.
Go ahead, Syed, please.
Sorry, I know. I was saying my concluding thought was that we're not going to really prevent misinformation. It is going to be a part of our society. It's going to be there. It has always been there. Lies, propaganda, rumors is a part of human race actually. So our job is actually, are we well prepared to protect ourselves and our people and our communities from the bad effects, from the effects of the misinformation? I think that's the challenge, but we really need to think of how best to enhance the good information and reach more people, and how best actually to make information available, because we also learn, and that's our observation in the last 2 years, that misinformation flourishes because there's no right information available, because there's no correct data available out there, and people start saying no, this number, that number, because nobody is giving right information out there in a timely fashion. So I think that will remain our challenge moving forward. Yeah, over to you, Davis.
Thank you so much, Syed. I mean, what you said is remarkable. Bad information flourish when there is no good information out there. And I think we all agree that as a fact checkers, our primary goal is to provide better information, more accurate information to the public. So the good information will hopefully, diminish the bad information eventually. And I just, for our audience, just want to let everyone know that DataLEADS has been running a lot of trainings and collaborations in APAC, in India, and in the Asia Pacific region. So there's a lot of areas of collaboration in that particular area that DataLEADS has been running as well. And it goes without saying that this virtual conference platform allows all of our participants to message our speakers, just reach out to them simply by browsing them through our speakers section. So please use that opportunity. And last but obviously not the least, I'm very happy to have this opportunity to wrap this part of this conversation with Clara. Given her position as a head of a manufacturing organization in Spain, but also as a part of our advisory board in the International Fact-Checking Network, being in a position that allows her to hear from a lot of different stakeholders. And I just heard, actually saw her typing in the chat that she was kind of like a little bit, excited that, to hear that YouTube is, communicating with WHO in a good way. So maybe, she can help us to see this from a perspective of fact checkers, what it means to collaborate with tech companies for fact checkers, and how this entire, episode, made things different, or maybe if not.
Thank you, Baybars. Well, yeah, I'm happy that YouTube is at least talking to WHO about disinformation and fact-checking. That's something, I guess. I brought some examples of the things that we've been doing, not only in Spain, but with other European fact-checkers. I do want to raise up 2 collaborations that have been happening throughout the pandemic. One is the Coronavirus Fact Alliance. Everyone that is listening to this conversation knows about it because they've built into that database that Cristina Tartaguila set up that has helped us so much. There was one thing that reflected upon me that Claire Wardell said, which is we don't have either the time nor the capacity to be fact-checking the same thing over and over again in different countries by different fact-checkers. And I think the COVID Fact Alliance, together with the work that LATAM Chequea, coordinated by Chequeado, has done around the pandemic for the Spanish-speaking countries, has been invaluable for that, because we saw in Europe and then we saw in the rest of the world how when one fact checker fact checked something, that same misinformation appeared in the different countries 2, 3, 5 days afterwards. That is kind of the work we did in Europe between AFP, Correctiv, Pagella Politica, Full Fact, and Maldita around the COVIDinfodemiceurope.com report. You can go into that webpage and check it out. It was a piece of work that we did for the first months of the pandemic when most of the European countries were on lockdown. First months for Europe, of course, not for Asia. When most of the European countries were on lockdown, that is March, April of 2019, 2020. I'm totally lost. I don't know how much time has gone since all this started. One of the things we tried to study while working together was to see how one hoax was born in one country, for example, in Spain, and sometime after reach all the other countries. We had our own database that enabled us also to publish fact checks from each of us if one of them reached us very quickly. I'm running out of battery. I'm sorry. I did not prevent this. You have several of those examples on that COVID-19 report, but it's not the only thing we did for this. I'm really sorry. I'm trying to do this as fast as I can, because if my computer goes down, then we're really going to have a problem.
That's all right, Clara. No worries.
I did it. The other thing we did is that we understood that in order to be able to respond quickly to any kind of misinformation that reached us, we need to have alliances with the scientific and the medical community in our own countries and be able to share them among European countries, at least at that first stage of the project. So, for example, Full Fact reached out to the Science Media Center in the UK to gather their info and their contacts so that we could quickly call them upon questioning. The same happened, for example, for a lot of medical units in Spain, in Italy, in Germany. We did alliances with a lot of different medical societies and science societies so that we could just pick up the phone and call them and ask them about the doubts we were having around fact-checking. And these alliances that have continued after the toughest months of the pandemic have proven very useful. One of the things we found was that doctors themselves and medical societies were wondering which were the best ways to reach their audiences in order to answer their questions around this information around the COVID-19. For example, these are two examples of the collaborations we did with them. One is with the Association of Pediatricians, for which we did an infographic in which they explain which were the most common misinformation pieces reaching parents around vaccination. And the other one was with the official School of Medicines in Madrid, which were being reached by a lot of this information that they were not so sure how to debunk so that the general public would understand it. So together with Efe, Verifica, and us, we tried to give them straightforward answers, translate basically what scientists and doctors said into something that the general public would understand so that they could also disseminate it throughout their own communities. Furthermore, and this is a personal example, we run this superpower program in which basically anyone from the general public can donate their expertise to Maldita so that we can, again, pick up the phone and call any kind of expert we may need to debunk something. This has been working for a long time for us, but especially during the pandemic, 150 doctors, nurses, virologists, and immunologists showed up in our database saying, hey, I want to help. You can call me and ask me doubts around the pandemic and around the virus. And thanks to that, we were able to do a lot of Twitch programs in relation to the pandemic, explaining specifics around them. And it was very surprising, but very gratifying to see that these were no doctors, and I don't want to, it's not down-ranking doctors in any way, but these were not doctors that were in a small village and had a lot of free time. These were the people that were in the front line of the pandemic in our country. Pepe Alcami, is a doctor that runs a very important unit of microbiology in the Institute Carlos III, which is a very prestigious scientific organization here in Spain. And Pepe Alcami is one of the experts of the ideologist of how the vaccination should work in our country. And they showed up on that database saying, hey, I want to help. I know that you guys can make our messages reach more people, and we're here so that we can share our expertise with you. And last but not least, in the side of scaling, and I know this is one of the things that worries fact checkers all the time. These are two ideas of the things we did throughout the pandemic. One is we set up 500 billboards in 50 cities in Spain. And obviously, Maldita cannot pay for 5,000 billboards around Spain. But we talked to the people that run those billboards because we saw they were empty, because since no one was at the beginning on the street, most of the companies were not making ads for the street. Basically, it was not like the type of campaign you would put out, yeah, please buy my perfume right in the middle of a pandemic, right? So they had a lot of free spaces, and they said, if you guys can pay for the printing, we can put them up for free. It was a way of reaching a broader public. And the other way of scaling our message and our reach was creating a WhatsApp automated chatbot. We're doing a show and tell on it. It's worked brilliantly for us. We went from receiving 200 messages to 2,000 a day. We were not able to manage a business account for WhatsApp. We created a WhatsApp chatbot, and now all our messages are automated. We can also intervene them, but it's changed the way we work. We don't spend so much time looking at junk, like Claire said. And we're also dedicating journalists to do journalism, which is what most of us here want. And I'll leave it there. Thank you, Baybars.
Thank you so much, Clara. And I can see in the chat that people are super, crazy about this, your program, the Super Doers. I mean, you have a lot of, supporters for, a lot of fans for that, program of yours. So feel free to follow up with Clara. And obviously, I mean, you can always, tune back to this panel immediately after this ends. So just want to address those questions as well. So I have a couple of questions for our panelists, and I will be just start with Natália, because people are wondering, like, especially during cases where you don't have access to make your reports credible. What do you do in those cases when you don't find reliable sources? In the case of the number of deaths, the number of tests available, how do you make yourself confident about the credibility of that data, Natália?
Thank you, Baybars. Thank you for the question. I think the credibility of data is always a concern in this scenario, of course, but we have in Brazil a lot of collaboration between fact checkers, journalists in general, and health institutions, and we, in fact, are doing the work that was supposed to do by our government. Our government have this strange idea about misinformation, about using misinformation to in this topic regarding COVID-19 as a weapon, and this is always concerning. But as Syed mentioned before, collaboration is the key in this situation. So I believe this made us be more confident about the data that we have from these collaborations. And about the tests that I saw, it was a question. They are not available in Brazil in the same way we see in other countries, for example, USA or something like this. But regarding how we are more confident, I am totally sure that this is about collaboration.
Thank you so much, Natália. Andy, you talked about the importance of surfacing quality information on platforms and, to the public, basically. And I'm just going to ask you, what's your take on if we are ready for the next health crisis? It's been more than a year, and we obviously have learned a lot. But do you feel like we are ready for another one?
Well, first of all, I don't think we're ready for this one yet. I don't think we've progressed as far enough along the road that we need to. We've seen some incredible progress in the last 18, 19 months. It's been a long time, but we've seen some incredible progress with platforms stepping up and technology companies stepping up. On a personal level, one of the feelings I have is the incredible support we've had from the tech industry and social media companies, not only with actual, jumping on the phone to see how they can help us to promote content and get content into people's lives, to being open to work on misinformation campaigns and provide us with millions of dollars of pro bono advertising. I think Clara mentioned it. The media companies and digital companies had a huge inventory of empty slots, and they donated that to nonprofits and to us. We've received millions. But, and it's a big but, I think that this is a marathon, and every marathon starts with a simple single step. And I think we've done a few, but we are not even halfway when it comes to fighting misinformation online. Misinformation spreads faster, further, deeper than the truth. And a lot of that, as Syed said, is human nature. But we have to become better as people, as individuals, at policing ourselves and our loved ones and our colleagues and our network. And we've got to become much, much more demanding of the platforms that we're on. When I travel for work, I don't get on the fastest airplane. I get on the fastest airplane that will get me there safely. And I think a lot of tech companies, a lot of social media companies are putting safety at the back and are not putting safety where it should be, like the airline industry, right at the front. Back to you, Baybars.
Thank you, Andy. And that's right. I mean, safer is better than faster. And we hopefully will, take this as a learning from this experience. But I agree that we are not there yet, unfortunately. Syed, you talked about how you set up this partnership between health professionals and fact checkers. And I'm pretty sure, and I can see it as in the chat, that a lot of fact checkers in different parts of the world are kind of exploring how they can also set up different similar partnerships. What would be your recipe or advice to those who are exploring similar collaboration between their organizations and health professionals to communicate fact checking and quality information in a much more effective way?
No, I think it's really important for journalism organizations to invest actually in terms of their manpower and also to explore the partnerships as early as possible with people who have expertise in different areas. So we're talking about health. Honestly, I'm looking more closely at the climate change. So we need to have a climate change scientist and fact checkers together to understand what's happening, because that's our next challenge, which will also hit us in terms of public health. And the key for collaboration is it's extra work. So the question is, are you ready to be there and invest more time of your organization, your own time actually, to build this relationship? And second, be transparent and be very open what kind of collaboration you're seeking. And we that really works well. And we learned in the last 4 or 5 years that a number of people, remarkable people, individuals out there, organizations out there who are willing to collaborate. But only if you have a clear vision and you're transparent what kind of collaboration and what is the end game in this collaboration. It's not a collaboration for the sake of collaboration, but what is the end value we're looking through this collaboration. But I seriously believe that journalism, fact-checking, it requires deep collaboration. Deep means open at a national and global level.
Thank you, Syed. That's really helpful. And just to build on that, there's a lot of issues that fact checkers face on a daily basis, and one of them is basically the presence of manipulated data out there, and this is creating a big issue for the public perspective on what is true or false when it comes to health and misinformation. Clara, I'd like to get your pulse on how a fact-checking organization that is supposed to do fact-checking economy, let's say on social issues, now more on health, growing on climate misinformation, how we as a community can overcome this to build that expertise on different topics while sticking to our, core responsibility to provide expert take on the data out there, and increase the trust in data by fact checking them as well.
So one of the things we've been doing since Maldita started is to have specific people dedicated to specific topics. And that way, for example, we already had a science unit before the pandemic came, and that meant that we had journalists that were prepared to read scientific papers, for example, but also that had enough resources to pull from to better understand the data they were receiving. I also think, anyways, that with the pandemic, we've all realized that even in countries where state data or official data should be confident and trustworthy, sometimes it isn't. And we've dedicated a lot of time, for example, throughout the pandemic, to understand the data that we were sharing and putting out, and the data that we were seeing reported on every national media. I think that we need more data journalists in fact-checking units in general. I don't think we have enough, and we need to do a better effort there. And also understand that even if we're very good at reading data, we need to talk to the experts that dedicate their life to study that data, to actually understand if the methodology is right, if there are no loopholes, if there aren't specific things in time that we should take into account when analyzing a series. A lot of things that we can not know about everything, I guess.
Yep, that sums it up, Clara. I really appreciate it. And I have to tell that, probably many people in our audience are really jealous of the fact that you're working in the office. So it's great to see that you are there with the amazing team. And we wish everyone to stay safe, to stay vigilant against this threat, against misinformation. And as a community, we are lucky to have such superheroes like you, Syed, Natália, and allies like Andy and others in international organizations that help the humanity actually to access quality information, especially during these challenging times. So I want to thank all of you for becoming my guest in the first panel of this year's Global Fact. We will be continuing with another panel, which I believe will be very interesting for many participants here. I'm gonna have a conversation with people from Facebook on the 5th year anniversary of the global fact-checking partnership between the community and the company. So please tune into that conversation and check it out. Our speakers either at the launch tables or directly email message them using the speakers function. Thank you so much, and see you on the next one.
Thanks a lot.
Thank you very much.
Thank you so much.
Thanks a lot.
It was great. I had so much fun. Thanks so much for doing this.
Thank you
Yeah,
so
I'm
much.
sure you're going to get a lot more questions in the next panel.
We'll see. All right,
It
guys.
was super fast. It was so fun and super fast.
Yeah, it was great. It was great. Thank you so much, everyone. I really appreciate it. Thank you.
Thank you, guys. Thank you,
Thanks a lot.
everyone.
Thank you very much. So good
Thank you
seeing
so
you.
much.
Bye.
Bye-bye.